Hello, everybody. There are a lot of PSC members here, over 100 people present now, but I think we'll have more folks coming in. Our guest today is Dr. Jennifer Rosen from the Department of Health and Mental Hygiene. Are you actually with the Bureau of Immunization, which is the appropriate title for dealing with this issue? That was the information that I had.
Yes.
So Dr. Rosen is going to give us a presentation on the COVID-19 vaccines and then be able to answer your questions. We have a couple of PSC people who are going to be saying a few words, but I just wanted to make sure that Dr. Rosen knows something about us. The PSC is the union that represents over 30,000 faculty and professional staff at the City University of New York. So that means people who are registrars, financial aid office workers, counselors, college lab technicians, classroom faculty, librarians, everyone in all of those titles, and then even a few more that I left out. And we're now up to 125 people. So we'll be a good size group here. I had a couple of folks from the PSC who wanted to say a few words. The first person I want to call on is Jean Grassman. Jean is a professor at CUNY's School of Public Health. And in the union, she works as a coordinator of our health and safety watchdogs group. She's going to tell us some of the things that the PSC has been doing during this crisis time to help make sure that PSC members are safe and healthy when they're at work. Jean, you want to go ahead?
Okay, now I'm unmuted. Okay, so thank you, Sharon, and I'm really pleased to be here as part of this town hall on Vaccination 101. And I have to say, to be able to be a part of something like this and to have this be a development that, although there are challenges, that we are fortunate enough to have a functional vaccine is really wonderful. So what I'm going to talk about for just a few minutes, not too long, is what at the PSC are called the PSC Environmental Health and Safety Watchdogs. And the watchdogs really deal with workplace health and safety issues. And to give a little setting for this, as mandated by OSHA, employers have the obligation to provide safe and healthy workplaces. And it means that CUNY, it has to protect all workers, and that's through maintaining buildings, providing PPE, training, and otherwise taking all the steps to keep us safe. So technically, we're not covered under OSHA, we're covered under PESH, which is Public Employees Safety and Health, and that's really the New York version of OSHA. And this has been a challenge because, there's been ailing infrastructure. If you're part of CUNY, you know what I'm talking about. Buildings are old, they haven't been maintained. So the watchdogs came about 20 years ago. They were founded by Joan Greenbaum and David Kotelchuk, who are on the faculty at CUNY. And what the watchdogs do is monitor and address workplace health and safety conditions at their respective work sites. So we've got watchdog committees all over CUNY. And so historically, during these 20 years, it was problems related to indoor environments. So temperature, mold, water leaks, construction. But then the pandemic happened. And and this is a story we know too well, which is New York was one of the first and hardest hit cities in the country. And CUNY has lost more staff and faculty to COVID-19 than any other university in the country. So step up watchdogs who have been critically important for this fight. And what happened early on in the pandemic is we started meeting weekly via Zoom, and we now have literally hundreds of watchdogs across CUNY at all the various locations. And I would just want to say that, in the beginning, there were so many unknowns. We didn't know how it was spread, and we didn't know how CUNY was going to protect us, because remember, they have the responsibility to do that. So we didn't know whether there was going to be a single policy or whether, you know, the steps for pandemic control and prevention would be done at the campus level. And so what happened was we really, us, staff and faculty became experts on COVID protection and learned about distancing and hand washing and mask wearing. And, we became experts on ventilation to the point that we have members who work in administration but they know exactly why a MERV 13 filter is needed, and they know the importance of maximizing outdoor air. And we pressured CUNY over this time to protect workers who they were essential workers continuing to travel to work on campus. These are the lab technicians, higher education officers, and part-time members who don't necessarily have the best job security. And when we finally understood that each campus was expected to develop their own safety plan, we made sure that we had PSC reps on those campuses. And we held our campuses to those plans. We watched them. There's examples, but what I can say is when there were deviations from the plan where members went into campus and they were expected to do events without adequate distancing and protection, we stepped in. So a major shift happened once we realized that transmission was primarily airborne. And that's where we started, really demanding that ventilation systems be up to the task. And it's not just the usual ventilation. You have to do really an enhanced ventilation to prevent COVID transmission. So our campus committees knew what to ask about. They demanded answers from facilities rather than going to the administration. So, we've had some major effect. So now we finally have some good news. We have effective vaccines. But we're also really aware of challenges that accompany that. So we're really happy to have Dr. Jennifer Rosen here today to talk about that. So the last little thing I want to mention is through the discussions of the watchdogs inside and outside of CUNY as well, we've come to understand that while vaccination is really critically important, preventing outbreaks on campus over at least the next semester and, into the future will require doing COVID testing and follow-up on the campuses. And what this will do, it will prevent asymptomatic or pre-symptomatic people from coming onto campus. And the precautions we've been using, those are still, those will still be needed. We'll still need to mask. We still need hand washing because they reduce, but they don't eliminate the risk of transmission. But testing and follow-up are really needed because we need to add another layer of protection. And this is particularly important when we're talking about the more contagious variants on hand. And they will arrive. They will be in New York. So we also want to emphasize on-site testing and follow-up are needed to protect our students who will be among the last to be vaccinated. And they're also needed to track the level of infection. Right now, the campuses don't know. They come up with numbers, but we really don't know the level of infection. And we all know the importance of data in following this. And it will also help alert members of our campus communities if they've been in proximity to someone who has tested positive. And we understand that there's privacy issues and that will be respected. So I just want to stop by saying thank you to the PSC leadership and to the PSC watchdogs who have met challenge after challenge and it's taken grit, it's taken smarts, it's taken persistence, and it's been a long time. So that's why I'm really pleased to move on and hear from Dr. Rosen. I'd like to welcome her, and this is important information. I'm really happy to hear it, so thank you.
I think next on our program is PSC President Barbara Bowen. It's not a union meeting without an action for union members to do. Our union strength comes from the fact that we act together collectively. And so I think that's what our union president is going to call on you to do.
Great, thank you. And thank you, Sharon, for setting this up, Jean, and all the health and safety watchdogs for incredible work. I mean, it was a beautiful description too. And Dr. Jennifer Rosen for being with us, and all the 171 people who are on this call. Fantastic to have you here. So yes, I think there are two things that we could do right away. And one, now that you've heard about the health and safety watchdogs, and I think some of you are on this call, join. As Jean said, there are hundreds across all the campuses at CUNY, people who have educated ourselves, and I count myself among them. I never thought I would know anything about MERV filters. Thanks to Jean and others, I now do a little. And we have educated ourselves together in an old form of empowerment. I think of the ACT UP self-education during the beginning of the AIDS pandemic, and how people educated themselves and seized that moment as a political activity too. So we have done that. So first of all, please join. There's lots of room on the health and safety watchdogs, and Jean has put in the chat how to join. And second, the CUNY administration must negotiate with the union about reopening. This nonsense that they keep mouthing about how they're consulting, how they'll put out plans, how they're consulting stakeholders has to go. We need negotiation. And the kind of testing that Jean spoke about, the ventilation standards, standards for PPE, just for washing your hands. Just yesterday, we had an issue at Bronx Community College about access to safe water. That's so fundamental, and CUNY must negotiate with us. So I want to ask you to do one action, and in addition to listening to Dr. Rosen today and the action of asking your questions, and that is to call your college president's office and say to your college president, you need to tell the chancellor that CUNY needs to come to the bargaining table and negotiate on safety for reopening. That's it. You want to be safe? Let's assume your college president wants the campus to be safe. If the college president wants safety for all, the college president must demand negotiations, because who is keeping students, faculty, staff, and workers safe? It's us, the workers. And we are vigilant, we are watchdogs, and we are keeping everyone safe. So I am really thrilled to be here and delighted, as Jean is, even to be talking about a vaccine. And just want to remind folks that the PSC sprang into action the very first weekend that the categories were being announced, phase 1B. We intervened. I went directly to the governor, directly to the mayor, and by the end of the weekend, together with support from our statewide union, we had higher ed workers working in person included in 1B. That's not everything we need, as you'll hear soon, but the union has been fighting, and we get the power to do that from all of your involvement. So I'm thrilled to turn it back to Sharon and say, you know, once you come out of this meeting full of new information, please use that, call your college president and demand that they demand negotiation with the union. So thank you all so much. Thank you to Sharon. And now we're going to go on, I think, to Dr. Rosen.
Thank you, Barbara. Thank you, Jean. I have to say, I'm really proud to have the reminder of all the things that the PSC has done in the last year. I'm happy, proud to be part of a union that fights for the health of its members. Before I turn things over to Dr. Rosen, I just want to remind you, I know you'll have questions, and the way for you to get your questions into the list is to type them into the Q&A box, and in the bottom of your screen, if you click on the little Q&A icon, you'll have a box that pops up where you can type your questions. Get them on the list right away. If we have more than can be answered in the time available, we'll collect them and then see what we can do to get the others answered afterwards. But now I'm going to turn things over to Dr. Jennifer Rosen from the Department of Health and Mental Hygiene. Dr. Rosen, it's yours.
Great, thanks so much for having me here. I'm going to share my screen. Okay. All right. Can you see my screen?
Yes, we can see it, but it doesn't have anything very interesting on it.
Okay. Do you now see it should say introduction to COVID vaccines?
No, we see the open Zoom meetings window.
Do you see it now?
Now, I think you might have to turn the screen share off and then make sure you select the right window when you turn it on.
Let's see. How about now?
That's it. Yes.
Great.
That's good.
Okay. Very good. Well, thanks again for having me here today. Okay. So I'm going to start off by talking about COVID-19 and inequities. More Black and Latino people have been sick, hospitalized, and died from COVID than any other racial and ethnic groups. And these differences in health outcomes are due to long-term structural racism, including policies and discriminatory practices and opportunities that negatively affect people's overall health and well-being. And the disproportionate impact of COVID-19 on New Yorkers of color highlights how these inequities negatively influence health outcomes. So our approach at the health department, for our approach, equity is central to our COVID response and to the vaccination program. And we know that we need to earn trust, build confidence, and deliver community-focused information and programming. And the agency commits to taking action to address health and social inequities that have been amplified by this pandemic. So we are happy to say that we have crossed the million mark. So over 1 million doses of COVID vaccine have been administered to people in New York City, which is incredible and a huge milestone, but we still have a very long way to go. This figure on the left shows the number of COVID cases per day, and you can see the first wave of the pandemic, and you can see that now we're in the second wave, and the second wave actually surpassed the first wave in terms of number of cases per day. And the map on the right shows the percent of people tested who are positive, and so you can see that COVID has impacted all of New York City, all neighborhoods, but certain neighborhoods have been hit harder than others, reflected by the darker red colors. Just a reminder, it's really important for everybody to continue the core prevention strategies like staying home if you're sick, staying 6 feet apart, and wearing a face covering. So now I'll give some background about vaccines. Vaccines help people to develop immunity or protection from a disease so that their body can defend against the disease if exposed to it. There are many different types of vaccines. Vaccines save lives, and they help protect the people who get the vaccine, and they sometimes also protect the people around them and possibly entire communities. No vaccine works 100% of the time, though, and some people can't be vaccinated because of a medical condition or because a vaccine may not have been approved for certain groups. And that's why it's important for as many people as possible to be vaccinated. Key messages specifically about COVID vaccines that I'd like you to walk away with are that COVID vaccines are safe and effective. They're available to New Yorkers at no cost. They're available to people of all immigration statuses, and vaccination is not a public benefit under the public charge rule. And when people are vaccinated, their privacy will be protected. There are 4 phases of vaccine clinical trials, and each phase studies whether the vaccine works and is safe. Phase 1 starts out with a small number of people, typically less than 100, and then expands to several hundred people in phase 2. During phase 3 clinical trials, thousands of people are vaccinated, and typically about half of the study volunteers receive vaccine and the other half receive no vaccine or placebo. And ideally, the volunteers in the study, their demographics should reflect the demographics of the population intended to receive the vaccine. And in some cases, phase 4 clinical trials are conducted after vaccines are licensed to continue studying and monitoring the vaccine after it's available to the public. For vaccines, the FDA monitors vaccine development from beginning to end. They analyze clinical trial data to decide whether to allow the vaccine to be used, and they continue to monitor vaccine safety data even after vaccine approval. We receive a lot of questions about emergency use authorizations and people wanting to know what exactly they are. So in an emergency like COVID-19, the FDA may allow vaccines to be used before they are officially licensed by issuing an emergency use authorization, or an EUA, so that we can use them right away. No shortcuts in the testing of vaccines are allowed, and all vaccines issued an EUA must go through the same clinical trials as all other vaccines. An EUA can be issued only if the evidence strongly suggests that the benefits outweigh any risks to patients. Several federal agencies and external organizations monitor vaccine safety during trials and as part of ongoing evaluations after vaccines are approved. And these safety monitoring systems are very robust, and they've been in place for a long time. And in addition to the existing safety monitoring systems, additional safety monitoring systems were established specifically for COVID vaccines. So now I'll talk more about COVID vaccines. There are many questions about how vaccines were developed so quickly, and people have expressed concern regarding whether vaccine safety was compromised in developing the vaccine so quickly. And that's not the case, but I'm going to walk you through how the vaccines were developed so quickly. For one thing, we were not starting from scratch. Scientists built on many years of research from other vaccines, including research on vaccines for other coronaviruses. And the other big thing is that the federal government provided special funding, billions of dollars, to allow development, testing, and production to happen at the same time. And that's not normally what happens. So normally with vaccines, manufacturers go through all steps of the clinical trials, and if the vaccine is determined to be safe and effective, then they would apply to the FDA for vaccine approval. And if and only if the vaccine is shown to be safe and effective and approved by the FDA, then at that point the manufacturer would first begin producing the vaccine. And that's because it's incredibly expensive to produce vaccines, and so nobody would want to spend the money without knowing if the vaccine will even work. But in this case, the money was provided so that manufacturers could produce huge quantities of vaccine. That way, if the vaccines were found, were approved, we'd be able to distribute them immediately. And the other big thing was that the government, health departments, and healthcare providers were working for months before vaccines were approved in order to plan for storage, distribution, supplies, and all the other logistics, which again, normally that would all happen after a vaccine was approved, but all these things were happening concurrently. 2 vaccines have been authorized by the FDA for use and are currently available in New York City, and those include Pfizer and Moderna mRNA vaccines. Other vaccines are in various stages of testing. Now I'll talk about the mRNA vaccine technology and how these vaccines work. So COVID-19 messenger RNA, or mRNA vaccines, contain genetic material from the COVID-19 virus, but they do not contain the actual virus, and they cannot cause COVID infection. Although mRNA is a new type of vaccine, the platform has actually been studied for over 30 years. So again, we weren't starting from scratch. And this is how the mRNA vaccines work. The mRNA enters the body with instructions on how to make a protein that's part of the virus that causes COVID-19. And the proteins that are made then trigger the body to make antibodies and other defenses. The mRNA is then broken down and destroyed by the body. The mRNA never enters the nucleus of the cells and cannot and does not interact with a person's own DNA. Then, if a person is later exposed to COVID-19, the body is now able to recognize the virus and produce antibodies to fight it. two approved vaccines, Pfizer and Moderna, are much more similar than they are different. In the phase 3 clinical studies, both vaccines were found to be safe and extremely effective across all gender, age, race, and ethnic groups. Both vaccines prevented sickness or severe COVID-19 in over 94% of study volunteers. And for reference, the FDA only requires vaccines to be 50% effective in order to be approved. And so these vaccines are much more effective than that. And these are among the most effective vaccines around. So we're incredibly lucky. Both vaccines require 2 doses, and both vaccines have similar side effect profiles. They both cause mild to moderate side effects. The phase 3 trials for both vaccines were huge, with over 30,000 study volunteers in each group, and both had very good representation of people across age groups and across race and ethnic groups. The Pfizer vaccine is approved for people aged 16 years and older, and Moderna for aged 18 years and older. At this point, we know a lot about the COVID vaccines. Many millions of doses have been administered in the United States, and now over 1 million alone in New York City. But there are still things that we don't know about these vaccines, including we don't know how long protection from the vaccine will last. And that's because the phase 3 trials, the data was submitted to the FDA about 2 months after people received the volunteers received their second dose. And based on that, we know that vaccine protection lasts at least for a few months. But the study volunteers are still being monitored over time to see how much longer beyond that protection will last. And so we don't yet know, will this be like the flu vaccine where people need to be revaccinated every year? Or will it be more like the tetanus vaccine where people need boosters every so many years? Or perhaps protection will be lifelong. We don't yet know. We also don't yet know whether vaccine is safe and effective for children, and that's because the studies that were completed were done just in people aged 16 years and older. Studies are now starting for children at least age 12 years and older. So we hope in the future there'll be vaccine for children. We also know that the vaccines are incredibly effective at preventing symptoms and complications of COVID, but we don't yet know whether the vaccine prevents infection without symptoms. So we know COVID infection can cause infection with no symptoms, and people even without symptoms who are infected can spread the virus. So more studies are being done to see if the vaccines also prevent asymptomatic infection. In terms of how vaccine is being distributed and groups that are prioritized, New York State determines prioritization for vaccination and the timeline for distribution based on CDC guidance, which basically prioritizes people who are either at increased risk of getting COVID-19 or who are at increased risk for severe COVID illness. And currently, people who are eligible for COVID vaccines include healthcare workers, people aged 65 years and older, residents and staff in nursing homes, homeless shelters, and certain other group living facilities, and certain frontline essential workers, including teachers and school staff. And beginning on February 15th, the eligibility will be expanding to people with certain underlying medical conditions. The list is not online yet of the underlying medical conditions, I don't think, but will be soon. And phased distribution will take time. Right now, there just is not enough vaccine available for all adults in New York City or in the country. And so different groups are being phased in over time, and we don't expect vaccines to be widely available until mid-2021. The best place to go to find out the current list of eligible groups and additional details regarding each group is nyc.gov/COVID vaccine distribution. The health department is ensuring equitable access to COVID vaccines by opening vaccine sites in communities most impacted by COVID-19, and by ensuring that communities receive clear and up-to-date information and resources, partnering with community-based organizations and community leaders like all of you, and speaking openly and transparently about what we do and do not know. There's strong evidence that the vaccines against COVID are safe and effective. They protect you from COVID-19, which can have serious health consequences, and people of all ages have been hospitalized and died during this pandemic. And some people continue to have health problems even after they recover from infection. So the vaccine is really important to protect yourself and may also protect those around you. And in getting the city vaccinated will help move us closer to ending the public health emergency and getting the city back on its feet. Currently, children less than 16 years of age cannot be vaccinated. Again, after clinical trials are done, we hope that vaccine will be available for children in the future. For all other groups of people can be vaccinated. For some groups like pregnant people or people who are breastfeeding, these groups can get the vaccine. However, there is limited information about the safety and effectiveness of the vaccines, and that's because people who are pregnant were not included in the clinical trials. That being said, it's anticipated that the vaccine should be safe for both the mom and the fetus, and these groups can choose to be vaccinated. But if anyone has questions about whether the vaccine is the right choice, they should speak with their healthcare provider. There are many options for where people can get vaccinated. In some cases, people can get vaccinated through their employer. For example, for healthcare workers, the city has sites that they run in all 5 boroughs. Different healthcare facilities and pharmacies offer vaccine. So there are many different options, but the best place to go is nyc.gov/vaccine finder to find a vaccine site near you and to make an appointment. In order to get vaccinated, first go to the website to make sure that you're eligible, and then schedule an appointment. Complete the New York State vaccine form. So after you make an appointment, there is a form for people to complete that that includes information about how, what makes someone eligible, and bring proof of eligibility when you go for your appointment, based on guidance that's online in terms of what you need. So for example, if you're eligible by age, there will be instructions on what documentation you would need to show, and make sure to make an appointment for the second dose. This is a screenshot of the vaccine finder. And just be aware that each vaccine site manages their own schedules. The health department and the city do not operate all or even the majority of the different vaccine sites. And so when you go on to make an appointment, each location will have instructions on how to make an appointment, which may be online or by phone. And I should add that appointment availability really depends on vaccine supply. Vaccine is shipped each week, and so depending on the supply, that will impact the appointments that are available. Make sure to get your second dose. The vaccine offers some protection after the first dose, but protect you more after the second dose. The vaccine is effective. The optimal effectiveness occurs 1 to 2 weeks after the second dose is received. And the second dose should be of the same vaccine type as your first dose. So for example, if the first dose was Pfizer, the second dose should be Pfizer. The schedule for the second dose depends on which vaccine you received. So for Pfizer vaccine, the second dose should be received 21 to 42 days after the first dose, and for Moderna, 28 to 42 days after the first dose. Most people report some side effects from the vaccines, which are usually normal signs that your body is building protection, and this is a good thing. Common side effects include soreness or swelling of the arm where you got the shot, headache, body aches, tiredness, and fever. And the side effects are usually mild to moderate and typically begin within the first 3 days after getting the shot. The symptoms usually last about 1 to 2 days after they begin, and are more common after the second shot. Older adults are also less likely to experience side effects. Again, these mild to moderate side effects are common and expected, and it's a normal response to the vaccine. But call your provider if you have side effects that concern you or that don't go away after a few days, or if the redness or soreness where you got the shot increases after 24 hours. If you develop pain or discomfort, you can talk to your provider about taking an over-the-counter medicine like Tylenol or Advil. And remember to get the second shot, even if you have mild to moderate side effects after the first shot, unless your healthcare provider tells you not to. Allergic reactions to the mRNA vaccines are not common. Talk to your healthcare provider before getting vaccinated if you have ever had an allergic reaction to a vaccine or injectable medicine, or if you are allergic to any ingredient in a COVID vaccine. Other types of allergies like food, pest, dust, pollen, and latex are not contraindications to vaccine. So people with these types of allergies can get the vaccination. And it's important to distinguish allergic reactions from the common and expected side effects. So allergic reactions usually start within minutes to an hour of getting the shot and may include difficulty breathing, swelling of your face and throat, a fast heartbeat, a bad rash all over your body, dizziness, and weakness. If you think that you're having a severe allergic reaction, call 911 or go to the nearest hospital. And I will add that all people are monitored after they receive the vaccine for 15 minutes. And certain people who have had serious allergic reactions, like anaphylaxis to other things in the past, will be monitored for 30 minutes. After vaccination, you still need to continue the same core prevention strategies like staying home if you're sick, distancing, and face coverings. And this is because, like all vaccines, COVID vaccines are not 100% effective. And also, we still need to learn more about how long protection from the vaccines lasts and the impact of vaccine on disease transmission. We will update our guidance if and when we can ease prevention measures. I also want to add that it's really important to take care of your mental health. This pandemic has been extremely stressful and challenging for everyone. And there are 24/7 resources available through the city. You can call 1-888-NYC-WELL, or you can text or go online to speak with a counselor 24/7. Thank you, and I'm happy to answer any questions.
Thank you, Dr. Rosen. And now is a time for me to point out, as I did in the chat, this session is being recorded, and we will be posting the recording on the PSC website. That will include the recording of the presentation that you saw on the screen. And I'm glad that's being recorded because there's a lot of information there, and I'm going to have to go back and review it again. So I've been, with the assistance of our staff member, collecting questions and trying to sort them out into categories. There's a list of questions that are about eligibility and how you confirm your eligibility. So a number of people that the PSC represents are in that category of instructors who are working in person. So people are asking, will I be asked to document that I'm in that category? Folks might have an ID that shows that they're employed by the city university, but is someone going to ask them, do I have to document that I'm actually working in person? Do you have can you give us more information about that?
I believe when you schedule a vaccination appointment online, you're told what documentation to bring. And so I would, whatever it says to bring is what you should bring. I don't believe that it says that you need some sort of documentation saying that you're teaching in person. But again, whatever instructions you're given when you sign up online is what you should follow. Again, for staff who, even if nobody is confirming or checking on site that you actually work in person, we do ask that people who work at colleges who aren't working in person, please don't get the vaccine right now, because there is limited supply and we need to make sure that people who are at highest risk get protected.
And sort of following from that, a number of us, while we're not teaching in person now or doing other in-person work on campus now, it is expected that there will be a much larger number of people working in person in the fall. Do you know anything about when those people will be eligible? Will we be eligible in time to actually be able to get both doses of the vaccine before the fall semester starts, like the beginning of September?
So we expect that vaccines will be more widely available to the general population beginning mid-2021. So I would anticipate probably over the summer vaccine will be widely available, and at that point people can go ahead and get vaccinated.
Okay. Let me try to see some more groups of questions. We've had several people asking questions of varieties of, are there plans to have sites available on CUNY campuses? What are the plans for opening up more very large scale sites like the Yankee Stadium site and sites of that sort in other boroughs? So I guess generally sort of what are the plans for expansion of sites in a variety of different communities in New York City and in large scale sorts of sites?
Sure. Well, just to remind everybody, right now, the limiting factor for getting vaccines out, it's not the number of sites, it's really the number of vaccine doses. And so, we are limited in the number of doses that the city receives. But as vaccines do become more widely available, we anticipate that that there will be more vaccination sites. So for example, in the future, pharmacies are now starting to, certain pharmacies will be receiving vaccine through a federal program. But in the future, once vaccines are more widely available, we anticipate that people will be able to get vaccine at the same kinds of places where they get the flu vaccine. So, many pharmacies, providers, offices, et cetera. And the city is making sure that vaccine sites are being prioritized in places that have been hardest hit by the pandemic.
A couple of rather specific questions. Is there a reason to prefer one of the available vaccines over another at this point? Suppose you're someone who's over 70 or over 80. Is there a reason that one of those vaccines might be better? Should someone wait until the other vaccines are available if they're in one of those categories?
No, there's no reason to prefer one vaccine over another. People should get whatever vaccine is available to them as soon as they become eligible. The two currently approved vaccines are much more similar than they are different. Really, the only difference is that one vaccine is approved for people aged 16 and older versus the other is 18 and older. But between those two vaccines, the bigger difference is just how they're stored. One of them requires an ultra cold freezer, which is not found at most facilities. So those types of vaccines are mostly just given out through hospital settings that have these special freezers. So, there's no reason to prefer one over the other, but certain vaccines are only distributed through certain sites.
And another sort of special situation, suppose you are someone who has a history of anaphylaxis. Should that person go ahead and get a vaccine even though we know that there are risks? What are the recommendations?
Yeah, so it's a great question, an important question, and it depends what the anaphylaxis is to. So people who have had anaphylaxis or serious allergic reactions to COVID, to say a first dose of COVID vaccine or to an ingredient in COVID vaccine. For example, one ingredient is polyethylene glycol. That's something found in many other things like certain colonoscopy preparations or polysorbate. People who know they have serious allergic reactions to those things cannot get the COVID vaccine. People who have had serious allergic reactions like anaphylaxis to any other injection, like any prior vaccination or injectable medicine, that's a precaution. So in those situations, people should speak to their provider, and they may be referred to an allergist to see if they could get the COVID vaccine safely. People with any other kind of allergic reaction to anything else, so to food or environmental allergens, or to antibiotics that you take by mouth, they can go ahead and get the vaccine. It's recommended that they get the vaccine. The only thing to note is that those people will be monitored for 30 minutes after they're vaccinated instead of the standard 15 minutes.
And I have one very common question that I am trying to figure out how to summarize. This is also very difficult to get an appointment, to find a place where appointments are available, to have that appointment still be available once you get signed up. Why is it so hard, and what steps are being taken to make this easier?
We recognize this has been very challenging and does come down to the fact that vaccine availability is just limited at this point. I know the city is trying to make efforts to make the scheduling process easier, but recognizing that it is challenging when vaccines are just not widely available at this point.
How effective is the vaccine even in preventing you from getting COVID-19 after just the first dose? Are there percents that are available, as we've seen with the 90% effectiveness for both doses?
Yeah, there are estimated effectiveness estimates based on clinical trials. And so for one of the vaccines, it's about 50%, and the other is it was 70 or 80% after the first dose. So there certainly is some protection after the first dose, but we don't know how long, we don't know how long protection from even 2 doses lasts, but it'd be even more of a question with just 1 dose, how long protection lasts. And for this reason, it's important to get that second dose.
So here's a biggest question again that we are having is that people can't get a vaccine appointment, or their appointments were canceled because there was no supply. So it seems the system that's developed in the city is one in which demand would be much more than the supply. Why was there not enough organization done to really prioritize the people who are in the priority categories?
Yeah, again, it's definitely something that the city is working on. The vaccine rollout has been phased, and New York City has to follow New York State protocol in terms of the eligibility groups, but the highest risk groups were eligible first, and so we've now had 3 rounds of additional groups being added on over time, but we know that it is a challenge to get these appointments.
I see another one on the allergy situation. If a person knows that they are allergic to very specific things, how can they find out what ingredients are in the vaccine so that they and their doctor can compare?
So the list of ingredients is on the health department website, and they're on the CDC website as well. But again, the ingredient in the vaccines that most of the ingredients, they're things like sugars or fats. Most of them are not things that would be expected to cause an allergic reaction, but polyethylene glycol and polysorbate, which is not actually in the vaccine, but it can cross-react. Those are things, certainly if someone knows they've had a severe allergic reaction to, they should not get the vaccine.
I had another question and now it's just blank. So let me go and find the next one I was going to ask. What happens? This is about timing for the second doses. What if during the window when you're supposed to get a second dose, there are no vaccines available? What should you do?
Everyone who gets a first dose will be able to get their second dose. The second dose supply is separate from the first dose. So really second doses are not used for people's first doses. Some people may, there is the recommended interval during which people should get their second dose. And if people can't get the second dose within that recommended timeframe, they shouldn't worry. It's expected that the vaccine will work just as well if they get their second dose later than the recommended interval. The reason why there is the recommended interval is just because we want people to get their second dose as soon as possible so that they're protected as soon as possible.
What about people who are not eligible now? So someone who's under 65 or doesn't have any of the pre-existing conditions or doesn't work in any of the categories. Do you think, what do you think the timeline will be when a vaccine will be available for those people?
Probably not until mid-2021. That's when we expect it to be more widely available to the general public.
So that means July, though, this year, right? That's actually 5-6 months is what.
Yeah,
I'm thinking. Is that really what the timeline is?
Yeah, I mean, we're talking several months before it's widely available to the general public. And in part, it also depends on, these other vaccines that are in development, if they're found to be effective and if they end up getting approval. Certainly the more vaccines we have approved, the easier it will be to expand eligible groups more quickly.
Can you go back and tell us a little bit more about how this vaccine was developed so quickly and why it was able to be developed so quickly?
Sure. So as I mentioned, there were many different ways that the process was expedited. I think one of the biggest things is that for vaccines, most vaccines that go into clinical trials never actually get approved. It's incredibly hard to develop vaccines. And so because of this, manufacturers do not normally start making their vaccine and producing it until they actually find out, they complete the clinical trials and find out if their vaccine is going to get approved or not. But then the manufacturing process, which is incredibly expensive, it's also very time consuming. In this case, the federal government spent a tremendous amount of money to allow these different manufacturers to start making their vaccine before we even knew if the vaccine would get approved. And again, that would never normally happen because it's incredibly expensive to do that. But that was done so that if and when the vaccines were approved, they could be distributed right away. And many other things were done in advance before vaccines were approved. This kind of steps that would also normally happen after vaccine approval. So all of the logistics about vaccine distribution that the health department does and medical providers, that was all done way in advance. And that's just not, normally that wouldn't happen, but making sure that there were enough supplies like syringes and needles and all of the other logistics were done in advance. And also these vaccines were not, although they're new vaccines, the platforms that they use, have been studied for other things in the past. So they really weren't starting from scratch.
Is it possible for a person to get their second vaccine dose at a different location from the one where they got the first one?
People should go to the same place where they got the first dose in general, unless you're told by the vaccine site to go somewhere else. The reason why generally you should be going to the same place is because second doses are set aside for people who received their first dose there. So it's really a logistical issue.
Another kind of special circumstance kind of question. Suppose a person has a compromised immune system and wouldn't be safe to go to a large vaccine site or a place with long lines or large volumes of other people. What's the kind of setting in which that person should try to get vaccinated? Hospitals, are there hospitals, small doctor's offices, places where that person would have access to vaccination?
Well, right now, most individual provider offices are not yet giving the vaccine. Most vaccine sites are, sort of larger vaccine sites, but there are many different options online, so people can go and see what the different sites are. In all cases, regardless of the size of the vaccination center, protocols are in place to make sure that people maintain distance and that they're masked and to keep things as safe as possible.
We've had a couple of questions about, we appreciate that at the beginning of the presentation, you discussed the importance of getting vaccination out to communities of color. Can you tell us more about what's being done along that line?
Sure. So, vaccination sites have been placed in areas that have been hardest hit, which, the communities of color have been the communities hardest hit. So making sure that vaccine sites have been strategically placed, and a lot of outreach is being done to community-based organizations to do presentations like I'm doing to people within the community, but also train the trainer type presentations so that we can provide trusted leaders and community groups in the communities that have been hardest hit with the tools that they need to be able to speak with their own communities and to provide education. We know there's a ton of misinformation out there, and information, plus these being new vaccines and a new pandemic, people understandably have a lot of concerns, and so we want to make sure that people get the education that they need to make an informed decision about vaccination and to feel confident in the decision to get vaccine.
Is there anything being done, considered about line jumpers, about people who manage to get themselves making appointments without being in any of the eligible categories?
I can't speak to that just personally. But I can say I know a lot of the majority of these vaccine centers are not New York City operated, and so I think probably the different sites are handling this on their own. But every effort is being made to make sure people are eligible. People have to fill out the New York State form that specifies how they're eligible for vaccine and bring documentation of eligibility with them.
Are there any physical conditions for which a person shouldn't get the vaccine, like types of cancers or autoimmune disorders or anything like that?
It's a great question. People with any medical condition can get these mRNA vaccines. There's no contraindication based on a medical condition. For many underlying medical conditions, many medical conditions put people at very high risk for COVID complications, hospitalization, and death. So if anything, people with certain underlying medical conditions, it's even more important that you receive the vaccine to protect yourself. There are, and people with many underlying conditions were included in the clinical trials, and were safe and effective. There are a few groups that, for which there's limited information. So people who are immunocompromised, so people with weakened immune systems. So for example, someone on chemotherapy or on a medication that weakens their immune system, like high dose steroids, they can still get the vaccine, but there is limited information on safety and effectiveness because immunocompromised people were not included in the clinical trials. So, we tell people they can get the vaccine, but for example, we don't know if the vaccine will work as well in someone whose immune system is weak. The vaccine may not protect them as well, for example. Same goes for people who have autoimmune conditions. There's limited information on how well the vaccine will work for them and on safety, but they can still go ahead and get the vaccine.
Some questions about authorizing a vaccine in general. Can you tell us, I know you mentioned this earlier, but what's the difference in the process for giving this emergency authorization when compared to what the normal circumstance would be for authorizing a vaccine?
Sure, yes, that's a great question. So it's expected that after a vaccine receives emergency use authorization, that in the future, the manufacturers will go ahead and apply for full licensure. So the emergency use authorization was, for both of these vaccines, was based on about 2 months worth of data after people received their second dose. And in order to be licensed, there needs to be 6 months worth of data after someone receives the dose. And so, it's anticipated that once that time frame is reached, the manufacturers will submit for licensure. And, that information will be helpful to determine, how, right now, as I mentioned, we know that if vaccines protection lasts a few months, additional time will tell us, how much longer beyond that vaccine protection lasts. And again, people will continue to be monitored for a period of 2 years. So we'll have over time, we'll know how much longer beyond that vaccine protection lasts.
Do you think that this vaccine will become something that's mandated? I know in elementary school now, there are a number of vaccinations that are mandated, and for our students, they have to provide documentation that they've had vaccines against several different things. Do you think that this will become a mandated vaccine? Would that be a good thing, a bad thing?
Yeah, it's a great question. Right now, there is not discussion about any sort of citywide or statewide vaccine mandate. Our focus is really right now just on educating people about the vaccine so that they have the information that they need to feel confident in getting vaccinated. The reality is right now, there's not enough vaccine for everybody who needs it, even in the high risk groups. So, it's going to be several more months before vaccine is widely available for the entire population of adults. And in terms of children, the studies haven't even been done to know if there will be vaccine, if and when there will be vaccine available for children. So at this point, again, our focus is really on education.
So question, thinking about education, there are a couple of people who have asked, what's the approach that you take to try to encourage a person who is resistant to getting a vaccine to get them to think that might be a good choice?
Sure, I think that's a really important point. And, I think first and foremost, as a medical provider, I give my strong recommendation for vaccination. But anyone who has concerns, I think it's important to recognize concerns. These are, everything's very new, and we want people to feel confident, and it's normal for people to have questions, and that's a good thing. And so, I think if people are hesitant, it's important to know what their concerns are and to ask them, what are you concerned about, so that you can provide them with the information that they need to address their concerns. And so I think it's important to be respectful of people and be transparent about what you know and what you don't know. And we hope that by doing presentations like this and information that we've shared online on the website, we have a lot of resources to frequently ask questions. We hope that people will feel more confident.
I had a question but maybe as a recommendation. Why don't these sites that are making appointments have a way to give people a waiting list for appointments? I say I read this as a recommendation just because I know of some places that do offer that. Why is that not a more universal approach?
It is a really good question. The issue is there's not one central group for all of these vaccination sites. I think there are over 100 different vaccination sites. There's a very large number of sites, and they are independent from each other. And so, I think it probably depends on, the capacity of that site and their ability to handle the logistics. But I think that is a very good recommendation. And hopefully, as more sites start to do that, other sites will think about it and see if they could figure out a way to implement that as well.
Do you know specifically which pharmacy chains are having vaccinations available now?
I don't believe that has started yet, but as other sites like the pharmacies are able to start giving out vaccines, the locations will be listed online.
We hear that there are all of these new variants of the virus. Do we have an idea of how effective these vaccines are going to be against those variants, and what kind of process will be necessary for adapting new vaccines for these new virus variants?
Yeah, it's a really hot topic, and a lot of work is being done to evaluate effectiveness of the vaccines against these new variants. For most of the vaccines, and for the 2 vaccines that are currently authorized, the manufacturers have said that their vaccines should be effective against the variants, but they may not be as effective as they are against the original strain. And so, that really highlights, another reason why it's still so important to continue the core prevention measures even after you're vaccinated. Even if a vaccine is less effective at preventing symptoms from an infection, really the most important thing is that a vaccine prevents serious complications like hospitalization and death. At the end of the day, that is the most important important thing for an individual's own health.
Suppose someone tests positive for COVID after having gotten the first dose of vaccine. I think given the symptom-free period, it's certainly possible. Should that person go ahead and get this second dose of the vaccine?
Yes, everyone should get the first and second dose, even if they've had prior infection. However, if somebody, and this goes for both the first and second dose, but if somebody is currently infected, they should wait until their symptoms have improved, and they should wait until they're no longer contagious before they enter a vaccination site, because we don't want to expose other people. When someone's told to stay home for an isolation period, while they're infected, they should wait until that period ends and they feel better before they get either their first or second dose.
I've kind of come to the end of my my questions, at least the ones that are medical questions. There are quite a number of other political questions and questions that I think are more properly addressed to the PSC and our relationship with CUNY. Oh, here is one more. There are some of us, some of us are living at least maybe temporarily far away from New York City, where there are places where there aren't many vaccines available. And the travel by public transportation would be 3 hours for some people. Should a person get on the train or the bus for a 3-hour trip to go for a vaccine in New York City? For me, it's been more, should I take the 5 hours to Potsdam to get a vaccine, which is one of the places where vaccines were available? Or should we just wait until vaccines get more widely available?
For people who are eligible for vaccination, you can get vaccinated anywhere where you are eligible to receive it. So for people who live in New York City or who work in New York City, you can get the vaccine in New York City. If you live in another area and you meet their eligibility requirements, you can get vaccinated there. But it really comes down to where you're eligible, and then it's a personal decision in terms of how you choose to get there.
And another kind of summary of kind of the probably one of the most common questions. I'm eligible. What's the best way for me to be able to get an appointment to get a vaccine?
So definitely go to the nyc.gov website, and there's a link that you can go to take you to the vaccination sites, and there you can enter your address to find, or your zip code to find the sites closest to you.
Sharon, could I jump in
Yes.
for a second? Because I hear them, you're doing a fabulous job. There's a lot of questions. And Dr. Rosen, fantastic, because you just keep responding and responding. But the question Sharon just pointed to, I see a lot of versions of that in the Q&A and also the chat. And it's certainly the one as the PSC president that I hear most often from members. I mean, Dr. Rosen, you just said to go on the NYC site and put in your zip code, and then watch for the providers that come up. I do that almost every day just so I can see what our members would see. And what I find is, as Sharon said, I go through each one, and each one, which would be Ryan Health and various others, will say no appointments available or check for availability. You click on that and then they show no availability. The only two that I've seen open are Potsdam and Plattsburgh, both fairly far. And that did raise the question for people who would be balancing potentially a long trip on the train or a bus to get there versus the safety of getting the vaccine. So I think for our members, and I know for other people in the city, it's very frustrating to hear go on the NYC site because you go there and you can't get an appointment. Several of our members had first doses canceled simply because there wasn't enough supply. So that leaves a lot of us asking, and I'm sure this wasn't your decision, but why the system was allowed to develop in such a way that there would be so much greater demand than supply, and it would be kind of a free-for-all. Whoever gets that little click first and sits on their computer for 20 hours and gets that appointment, they got it, and that means somebody else didn't get it. And that, to a lot of us, does not feel like a good way to distribute something so life-saving and so important. And I assume that you aren't the architect of that. You're not the person who decides how much vaccine will be made by the suppliers, but the system is enormously frustrating to our members. And when we hear just go on the site, and then you go on the site and there's zero possibility, I think that's frustrating. Can you help us with that?
I totally understand, and I think it is challenging and frustrating for everybody. And again, it does come down to limited vaccine availability. I have nothing personally to do with the systems for appointments. I'm not working on that at all, but I know this is a national challenge. again, very challenging, and you're balancing trying to get the vaccine to as many people as possible with limited doses. And so, you're exactly right. Everyone is saying that, you go online and it's very hard to find appointments, or you might see one, but then it's taken up right away. And the city is aware, over time, vaccine availability will increase, but we are not there yet. So I know that the city is trying to improve the process. This is definitely something that everyone is aware of, these challenges, and there's an effort to make sure that the people who need it the most, although everyone eligible needs the vaccine, but there are groups that are in the highest priority group that were available from the very start that are still having problems getting it. And so the city is trying to prioritize helping to make sure that people from the very earliest groups can get the vaccine. But beyond that, again, this is not, I am not personally involved with the appointment system, but I do hear your concerns and know that these have been raised loud and clear, at high levels.
Great, thank you. Well, I hope they can address them, because some of those problems that we described also compound the inequities of race and economics that you started with, and it was great you started that way. But for people with limited access to Wi-Fi, people without those skills, people who are older, maybe not comfortable endlessly punching in, clear this site, check again, those inequities and vulnerabilities are just being amplified. And a lot of us are concerned about our students, who are about 80% people of color, largely from poor communities. And a lot of us are concerned that they will also be left behind in this kind of free-for-all scramble to get your appointment.
Right. And, I know that there are efforts to sort of identify priority groups to help to provide special assistance with getting appointments for people who, to make it more equitable. And you're exactly right. Not everyone has internet access. And so there are efforts underway. The city is working with different groups to try to help certain communities that are, really have been hardest hit, and to make this equitable.
Great. Well, please convey, and I know we will tonight when you join us again, that the PSC, the union, we've offered both the city and state to facilitate a vaccination distribution, to work with our students, for our students, work on our campuses. I think there's a lot of potential there that could be used, and a lot of us are eager to do that.
Great, thank you.
I've just been reviewing my list of questions again to see if there's anything else that I need to ask, but
Sharon, somebody asked in the chat a specific question, medical question about, I think it was that the interval between their first and second dose was 5.5 weeks, and rather than the 3 or 4, that's the recommended dose. I think didn't see it all because it went by fast in the chat, but I think the question was, will that diminish my capacity to get a good immunization?
No, you getting the vaccine beyond the 6 weeks will not, it's not expected that will reduce the effectiveness of that second dose. The concern is just we want people to be as fully protected as early as possible. And so that's why we want, we hope that people can get the vaccines within the 6-week period, but not because the vaccine won't work as well if you get it later.
Great, thank you.
so here's another recent question about the process of providing the vaccine. Is there a plan in New York City of doing more of bringing the vaccine to people, bringing to specific neighborhoods, bringing to people's homes? I'm from West Virginia. West Virginia doesn't do much right, but one of the things that West Virginia did right was bring vaccines to institutional facilities very early. So to bring vaccines to elder care places and such. It's the reason that they had a good rollout is that's one of the places they started. West Virginia is not New York City, but Do you know if there's anything like this under consideration?
Yeah, long-term care facilities were in the very first group of groups that were eligible, and so there were partnerships with pharmacies working directly with the long-term care programs to get them the vaccine. In general, though, vaccines, these particular mRNA vaccines are not easily transportable. So, like flu vaccine, it's easy to give vaccine to visiting nurses who can go home to deliver vaccine, or to have mobile vans. The problem, these mRNA vaccines are not very stable. So they don't, you can't keep them out for long periods of time, and they require freezers, and one of them requires special freezers, which makes it much more challenging, in terms of the storage and handling. Some of the other vaccines that are being studied right now that haven't yet been approved, they are a lot easier to transport, and their storage, for many of them, the storage just requires refrigeration. And so we think that will be incredibly helpful in terms of mobility of the vaccines.
Thank you. I just have a related question to what the other panelists have. And you started out by talking about the inequities and accessibility to vaccines. And my understanding from reading about it is that one of the inequities is access to computers and just the electronic appointment system. And I understand that, it's possible to roll out the vaccines via, in care facilities, but I was just wondering what the city has to, get through this barrier, which is just, having internet access, and offer some other ways that people can make appointments.
Yeah, no, very important point. So again, different things are being done. I know there are partnerships with the NYCHA housing communities to help people get vaccination, and other work being done in partnership with other community group organizations to help people, to make appointments on people's behalf. And again, the priority is these neighborhoods that have been hardest hit by COVID. So separately, there are efforts underway to work with people who are homebound to help them to get appointments and facilitate their getting vaccinated.
So let me make one more pass through my question document and see if there's anything else that
Sharon, we had a question about whether somebody with cancer can take the vaccine. Did
yes.
we got to that,
Yes,
right? Yeah.
We did ask that one.
Yeah.
Oh, here's one. What about the person who has had COVID-19 documented? Should that person take the vaccine?
Yes, people, even if you've had past infection with COVID, it's recommended that you get the vaccine to prevent reinfection. Usually during the first 90 days after someone's infected, they are less likely during the first 90 days to become reinfected, but reinfection can occur, especially beyond that period. And so it is still recommended that people get the vaccine.
And I have one more person, again, talking from the position of being immunocompromised and with serious concerns about going to the location where the vaccine is available, concerned about being exposure to all the other things that could be in that environment. This person has suggested that that there be special sites available for people who are in that kind of condition. Do you have any knowledge of that?
No, the challenge is all of the groups that are being prioritized are at high risk. They're at high risk, and we want to make sure everybody is safe. And so the different sites are, all taking precautions to make sure that people are distanced and masked. I totally appreciate what they are saying, and again, it's important when you go for your appointment, make sure that you're masked.
Thank you, Dr. Rosen, and I want to also include thanks the staff members at the Department of Health and Mental Hygiene who I worked with in setting this up, and I also want to thank James Bernard, who's my contact with folks in the city government, who with a title that says Strategic Outreach, Department of Youth and Community Development. What James does is outreach, and he contacted us to see that so that we would be able to offer this town hall. We appreciate it enormously. Thank you so very much. Thanks, Dr. Rosen, and I'm glad that everyone was able to be here. I hope that we answered most of your questions. You received emails from me as an invitation, so if you have other questions that we didn't answer, just send me an email and we'll see what we can do about getting an answer for you. This presentation will be posted on the PSC website. I don't have a timeline yet for it, but we will get it up as quickly as we can and maybe see about making an announcement of that once it is available. Thanks again, everyone, and I'm glad that you could all be here.
Thank you, Sharon. Thank you, Jean. Thank you, Dr. Rosen.
Thanks for having me.
Thank you, members, for being here.